Hi, I'm Dr. Visser, and I'm going to talk a little bit about gallbladders today. Gallbladders are storage organs. They store something called bile. Is how the liver helps get rid of the stuff out of the bloodstream that it filters out of the bloodstream. It gets rid of the extra cholesterol the body doesn't need. It gets rid of the breakdown products of red blood cells that way, and it also produces what's called bile salts, which help digest fatty foods. The liver makes about 1 liter to 1.5 liters of bile a day, and it goes down this tube called your common bile duct into the very first part of your intestine. When you don't need the bile to help digest the fatty foods, there's a little muscle at the end of that tube which closes off, and that bile then backs up into your gallbladder, and your gallbladder's job is to store that bile and concentrate that bile. When you go to eat something with fatty food, that is sensed by the first part of your intestine, and it sends a hormone signal off to your gallbladder and tells it to squeeze and empty. And that's how the system is supposed to work. When you form gallstones in your gallbladder, the gallbladder can go to squeeze and empty, and sometimes one of those stones blocks the bile duct that drains and fills the gallbladder, which causes pain. Typically pain across your upper abdomen in a band-like pressure. Makes you feel like you need to belch or vomit sometimes. It can be a balled up fist underneath the right side of your ribs and even go through to your back. It can last for about 30 minutes or up to 3 days, and sometimes it can be kind of painful. But usually when we have patients showing these symptoms, we usually recommend that you have your gallbladder removed. We don't have any other way to deal with the stones efficiently. Over about 120 years, they've tried to come up with ways to get rid of the stones, and the best way we still have is to get rid of the gallbladder. We take out the stones because these stones can cause all sorts of worse problems than just these episodes of pain. They can cause infection in your gallbladder, infection in your main bile duct, and it can even cause something called acute pancreatitis, which can make you very ill. So we like to avoid those problems. So we typically remove the gallbladder when this happens. It's a very common operation. We do it with 4 little incisions and a tiny camera that we look into your abdomen with, and we take the gallbladder out, usually as an outpatient. You come in, you get it done, you go home the same day, and within a couple of weeks you're close to normal again. Most people don't even know they're missing their gallbladder, and it's usually pretty straightforward. You probably know lots of people who've had their gallbladder taken out. It's something that we do quite frequently, and if you're having any symptoms, pain across your upper abdomen, specifically after eating food with fat in it, pain up underneath your ribs that lasts for about an hour or two, pain that can go through to your back, then you may want to talk to your doctor about getting an ultrasound to look for gallstones.